the world. I would like to speak about negative sides first of all. Lockdowns of people which affected to mental health, and as a result of lockdowns, suicides all over the world increased. Economy went to crisis as a result of closing the borders with other countries, and still there are countries that they are keeping their borders closed. Not all of them just open their borders. And as a result of it, the trade among countries was limited, and the food prices especially increased highly in the world. So we are going to crisis currently. Positive sides of COVID-19 is pollution decreased in that period. We observed, all of us observed it, in the air and nature. Hygiene became more important for people. We understood that hygiene and sanitation is very important for everyone. And medical system was developed after pandemic and still developing, because during pandemic all the countries faced the same problem, and so that we have still problems in medicine system, and we are trying not to meet again with pandemic. So now my country starts, Azerbaijan. First of all, I would like to speak about social determinants of health. What's it? It's relatively new term, and it's defined by the World Health Organization. It means the conditions in which people are born, grow up, live, work, and age. And I would like to speak these conditions in my country. People life expectancy is 73.33, and it's increasing percentage in 2023. The first place in the world, Costa Rica, by 80 years. Air pollution in my country is 17.5 in world air quality, occupying 57 place in the list. And for air pollution, is the first place is the Bangladesh. And 51% of air pollution comes in my country from transport, unfortunately. We are still have problems in transport because we are not like changing our transport to electricity. And we have just few, only people who can afford. But most of transport just gives pollution to air. And Baku wastewater network serves 72% population in the city. Only 50% of water is treated. 90% of treated water is biologically processed, and only 10% is mechanically processed. And current health system in my country, as we are, my country is a post-Soviet country, we are still continuing the post-Soviet system in health, but we are just already improving our health system, and we are changing to international standards. Our public healthcare system is free for our citizens, but I wouldn't say that the quality is very high in public. We still have problems. But private sector is really developed, and Bonadia International Hospital also was opened in my country in 2018. And currently World Bank system helps my country to improve and to provide much more hospitals and medicine system. And health tourism, I would like to say that mainly doctors coming from Turkey, Iran, Russia, Georgia to my country. So we have also European doctors and international doctors in my country. And